Hi, I'm Amy Houlihan. I'm a master's prepared nurse practitioner that's working in Omaha, Nebraska, and I'm currently also working on my doctorate in nursing practice. I'm here to take a few minutes of your time to talk about improving transitional care. In particular, Medicare patients that are currently using the post-acute care setting as they transition to the acute care setting. Post-acute care settings include skilled nursing, inpatient rehab, home health, and long-term care. There are currently 5.5 million Medicare beneficiaries that are using the post-acute care setting. The IMPACT Act was passed in 2014. What this act attempts to do is standardize across the four settings quality metrics and patient information. But what it fails to do is have that information transition with the patient in a portable way out of the post-acute care setting and into the acute care setting. Approximately 25 to 33% of the time a patient requires hospitalization annually that's currently in the post-acute care setting. And believe it or not, 93% of those patients come with incomplete or inaccurate information from the post-acute care setting when they are being admitted to the acute care setting. That means it's a lot of work for me as a hospitalist nurse practitioner to dig through that information, if they come with information at all. It's true that there's a quality gap and a resource gap between the post-acute care setting and the acute care setting. The first one that's very obvious is the informational technology structure. It's approximately 7 to 10 years behind the acute care setting. Well, the acute care setting had help from the federal government with the American Recovery Act back in 2009. The post-acute care did not benefit from that financial boost. The other thing is the staffing composition is different. You use more nurses aides and LPNs in the post-acute care. This may or may not lead to a lack of accountability. There is no current source of accountability to provide information from the post-acute care setting to the acute care setting. Hence, there needs to be an amendment to the IMPACT Act to have this information transition with the patient. By having that information, I can avoid redundant testing and possibly even avoid hospitalizing the patient. So what do we do to fix this? One thing we can do is have the federal government boost the IT infrastructure in the post-acute care setting. It's only fair. The acute care setting had this government support, and it's time for the post-acute care to have it as well. And I believe in a standardized transfer form or a standardized transitional care form. This will include the IMPACT quality metric data as well as the patient information data, including their code status, medications, allergies, medical history, baseline cognitive functioning, and all the other quality domains that are implied in IMPACT. So what I'm asking for you today is to help promote and pass the IMPACT Amendment to enhance the quality of care as Medicare recipients transition from post-acute care to the acute care setting. It decreases provider burden and hopefully prevents financial strain on the healthcare system by avoiding readmissions and possibly redundant testing. Thank you for your time.